Hello, I am Dr. Santhakumari, Assistant Professor from the Department of Public Health Dentistry, VMSTC. I welcome you for today's topic, health promotion. Today, we will be discussing an important concept in public health, health promotion. We will also look at how the WHO's health promotion logo was developed to represent this idea, especially through the Ottawa Charter. Here is what we will be covering today. We will start with an introduction and definition, then move on to the major health promotion conferences and the creation of the logo. After that, we will look at the 5 priority action areas and the different approaches to health promotion. Finally, we will wrap up with the conclusion. So let's begin with the Ottawa Charter. The Ottawa Charter was developed in 1986 in Canada as a part of the Global Health for All strategy. It marked a shift from a purely medical model to a broader social model of health. The Charter introduced 5 action areas and 3 strategies to guide how health programs are planned and delivered with a clear actions and strong community involvement. Let's begin with the definition of health promotion. According to the Ottawa Charter, it is a process of enabling people to gain control over their health and improve it. It emphasizes empowerment, which means helping individuals and communities to identify their needs, cope with the challenges, and see health as a resource for daily life. Now, we will see the WHO health promotion conferences. WHO has consistently supported health promotion through series of international conferences, starting from Ottawa Conference in 1986 to Helsinki Conference in 2013. Each conference has expanded on the principles of health promotion and they emphasized different action areas in health promotion. These events laid the foundation for global health strategies. Now we will see how the logo was created for health promotion. During the first Ottawa conference, a visual identity was created for health promotion. It represents not only the ideas from the Charter, but also acts as a globally recognized symbol for health promotion activities. WHO adopted this logo to unify the health efforts around the world. Here is the logo itself. You can see a circular design with the 3 wings and key action areas labeled. We will split this down and understand what each element represents. Let's see the graphic elements of the health promotion logo one by one. First of all, the logo includes an outer circle, a central spot, and 3 wings originating from the center. Among these 3 wings, one of the wings breaks through the circle, signifying the idea of expanding health promotion beyond the traditional boundaries. Now, this logo shows the outer circle, originally red in color, which represents the idea of building a healthy public policies. This red circle represents and serves to hold everything together like policies do in real life. This red circle surrounds the 3 wings, showing that public policy should support all aspects of health promotion. Next, we will look at the inner circle of the logo. This round spot represents the 3 core strategies of health promotion, which is enable, mediate, and advocate. Enable represents ensuring equal opportunities and access to resources for everyone. The next one is mediate, which represents coordinating the all health related actions across all sectors to tackle the health determinants. And finally, the advocate represents making health as a top priority in policies and decision making. Together, all these strategies form the foundation for lasting health improvements. Now, we will see the 3 wings in the logo. These 3 wings originating from the center spot represents 5 key action areas. Among the 3 wings, you can also notice one of the wings breaks through the circle, which signifies the idea of expanding the health promotion beyond the traditional boundaries. Now we will see the action areas for the health promotion. Health promotion is not just about what individuals do. It's about the social, environmental and economic factors that shape the health. Let's look at the 5 priority action areas identified in the Ottawa Charter. These 5 action areas gives us a complete strategy in health promotion. They are building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. Together, all these things form a holistic approach in improving the public health. So let's begin with the first action area. The first action area is building healthy public policy. This means making health as a priority in all policies, starting from education to housing, transport, etc. How to achieve this? For example, providing an affordable clean water, tobacco regulations, taxes on sugary drinks are all sort of healthy public policies which are directly associated with an individual or community well-being. Such laws and policies protect people and create healthier environments. So, who is responsible for making such policies? Nothing but governments, public bodies, unions, NGOs and lobby groups. The second action area is creating supportive environments. It means making the places healthier and safer where we live, work and play. Examples we can include schools that serve healthy meals or making smoke-free zones, or the environment that highlights the supportive environment for health. So, this responsibility is basically shared by governments, communities, employers and families. The third action area is strengthening community action. It is about the communities taking ownership of their health by identifying their own needs, setting priorities and creating solutions for their concerned problem. So, as we all know, when people are empowered to act, the outcomes are more sustainable and effective. So, next coming to the fourth action area, which is developing personal skills. This is all about giving people the knowledge, skills and confidence to make a healthier choice. We do this through education, awareness campaigns and skill building programs at places like home, schools and in workplaces. To achieve this, actually we need to take simple steps like teaching children proper brushing technique or guiding patients to manage how to manage their stress, which will create a long-term health benefits. The next we will see the fifth and the final action area is reorienting the health services. It means shifting our focus from curative point to the prevention point. This involves includes research, training and community strategies. Also, it makes the health workers to act as an educator rather than the facilitators. Here, we can take a dentist as an example. To understand it better, we have to take a dentist as our example, who basically teaches a proper brushing technique during a treatment. So, the individuals, communities, professionals and health services and governments are all share this kind of responsibility. So far we have discussed the action areas in health promotion. Now let's look at the approaches used in health promotion. These approaches show how strategies are implemented in any kind of health sectors. There are 6 main approaches in health promotion. They are educational approach, preventive approach, behavior change approach, empowerment approach, advocacy based approach, social change approach. We will explore these in detail in the next coming slides, but remember, the right approach depends on the health issue, population and available resources. Let's start with the educational approach. To understand this, we can take an example of an awareness program on sugar and the tooth decay, which helps the individuals to decide for themselves. The goal of this approach is to give people knowledge about the health and the well-being, so that they can make informed healthy choices. Also, we have to note one thing in this approach, which doesn't force a change. This approach doesn't force a change, but actually it offers options to the people to choose their choice for promoting their health. So this is being done through various methods like lectures, workshops, media, awareness things, etc. Next is the behavior change approach. In this approach, it goes beyond giving an information to a patient. That is, this approach persuades the people to act on it. To understand this better, let us take an example. A dentist not only informing a smoker about a risk, but he also motivating them to quit. This expert-led approach assumes that if people know better, they will do better, leading to a sustained behavior change. So the next one is the third one, is the preventive approach. Here the approach aims to reduce the disease levels by taking action before the illness occurs. For example, let's take the oral cancer screening programs. Here this type of screening programs are being conducted to detect early lesions and provide preventive measures. This approach is often seen as a top-down method where the health professionals act as an experts and patients act as a passive recipient. So the only limitation of this approach is it doesn't address the root cause of a disease. But for example, why people are exposed to risks in the first place is not being analyzed, just it is screening the number of people who are affected by the oral cancer. Now let's look at the empowerment approach. This is a bottom-up method where the health professionals, not as an instructor but as a facilitator. The goal of this approach is to help communities to identify their concerns. They help us to set their own priorities and build skills to take action themselves pertaining to the health aspects. It encourages the participation of the individuals and creates a sustained long-term improvements in the community health. The final approach is social change approach. This approach focuses on transforming environments through laws, policies and reducing inequalities. This requires a political support and planning. Thus, it is a powerful approach for a long-term and large-scale health improvements. So far, we have seen all the approaches in health promotion. Since each approach has its own strengths and limits, combining them would work best for promoting overall health. This slide explains the health promotion under the levels of prevention. Here, the primordial and primary prevention aims to stop risk factors before they appear. For example, through a physical activity and a safe housing which is directly associated with the overall health. At these levels, key interventions include education, health promotion and protective strategies are mentioned to support healthy living. Let's look at this powerful illustration which represents a key concept in public health. The upstream downstream model, which was introduced by McKinley in 1979. Imagine you are standing near a river. Imagine you are standing near a river. You see people drowning and struggling in the water. What would you do? Naturally, you start rescuing them. That's what we call it as downstream intervention. That is, managing the problems after they occur. But after a while, you wonder why are so many people falling into the river in the first place. So you go upstream and discover that people are being pushed from near factories, probably due to poor working conditions, pollution or lifestyle habits. That's where the real change needs to happen, that is at the upstream level, which means tackling root causes in society and environment. So this is known as the upstream and the downstream approach. Okay, now we are concluding it. So therefore, the health promotion is not just the responsibility of the health sector, but it goes beyond the healthy lifestyles to well-being. So the health is not just about treating diseases, but about the way we live and the conditions around us. So the new public health calls for stronger policies, supportive environments and healthier lifestyles so that the communities can truly achieve lasting well-being. So these are my references. Thank you.